it's live now. Today, we're going to be talking about dietary supplement quality guides. Okay. Now, our focus today is to assess how do you know a good vitamin versus a bad vitamin. So we got a group of individuals here, and we've got the little marker there. We are focusing on determining what is a good supplement and a bad supplement. Now, all of us, we all want the best. We all want to make sure we take good supplements. But as a lot of people will know, it's like wine. A lot of people want wine. And how do they pick wine? Well, the prettier label. No, it's not. It's sometimes you look at supplements and you say, and there's a lot of marketing effort to determine what is a good supplement, and you really don't know the quality. So a lot of it is based on trust of the company. A lot of it is the quality, the fillers, and we're here today to discuss what type of supplements are good supplements. So our goal today is to come up with a reasoning and assessing what is a good way of looking at a supplement. Now, I know that Adriana, she works with a lot of athletes and a lot of trainers, and we have Adriana here. So say hello, Adriana. There we go. And we got Ana Paola Rodriguez Arciniega, and we got Faith over here, who's going to be analyst in the certain components. So what we want to do is we want to bring in different ideas at the right time. So right now, I'd like to know, what is it that fitness people, when you say take protein or a supplement, what are they interested in finding out about a supplement in terms of the quality, Adriana?
Yes, they want to know a lot. Hello.
Hello.
They first want to know. They first want to know about the dosage. So, what dosage is good for me? Each body has a different type of absorption, or how they absorb vitamins and nutrients. So that depends also on the dosage you're going to take. Also, something they want to know if it's safe. You have to make sure that the product that you're using is FDA approved, and that is very important. Sometimes we see supplements that say, when you see the labels, they say at the back, at the end, like some ingredients not all disclosed, and that's when you have to sometimes be suspicious of labels. Also, you want to know if the product really works, if it's really efficient. So this goes back to the dosage that your body needs and should take. And also, I think one of the most important things, and it has to do a lot in the making of the decision of buying or purchasing the product, is the cost. Is the cost benefit really good? Or is there something, is it too expensive? Sometimes, as you said, the marketing brings us to buy a certain brand or something. And sometimes it's not the best one just because the dosage is not there. It has a lot of fillers, and you just really are not getting what it's worth your money. So that is something to see into.
Let me ask you in terms of we're going to be talking about this, but Ana Paola, tell us a little bit about the way that you recommend choosing the right brand or right company in terms of supplements, just as an introduction.
Well, something that we're looking for is the brand certified? Who is telling us that this brand is safe? So that is something very important that we're looking at. Also, I like to know if the supplement is giving me the 100% of the daily value that I'm needing for my RDI. So that is very important for our supplement intake as well.
So let me ask you, like, when you look at let's talk about the reading of a supplement line. Okay. And just let's go dive right into it. Do you have capacity to take over the view? Let me make sure I got you, and I'm going to make you a co-host as we do with these things.
I'm pretty sure that I can share my screen right now.
I'm just making you a co-host. So there you go. So you're a co-host. So go ahead and see if you can share the screen on the area that you want to talk about and present.
Okay, let me know when you have it on your
screen. I do. I
have
have it on my screen, and I can see it there live.
So reading a label is really important, and we've seen this in most of our packaged foods, but we should know that in our supplements, there are also a lot of nutritional facts that we need to know about. So in order for us to know if the supplement is working for us, or is something that can be certified, or that has a good dosage, that has a good form, and that the evidence that is supporting that supplement is working, we should go directly to the supplemental information. So basically what we need to know about the supplement facts or this supplement sheet is that we need to know how to read it. And of course, the first thing that we're going to have is the title. And the second most important thing is the serving size. Sometimes we see a package or we see a label and we see that our supplement has around 60 pills or 120 capsules or something like that. And when you go back and turn around and see the nutritional label, you can see that the serving size sometimes is up to four capsules or 4 tablets or four gummies. So that is something that we need to consider. What is the amount of the serving size that will supply me with the right amount of that specific nutrient that I'm searching for? So this is one of the most important things that we need to know about this fact, the serving size. The second, well, we have the third, the servings per container. And this is something that most of the times comes in the front of the package of our supplement. So this is something that is nice to know in a supplement facts sheet. Something very important that I find very interesting in this label is the number 5, which is the percentage of daily value. And when you go ahead and say, let's have this example, the one from the vitamin C, we have the name of that vitamin that this supplement is providing us. And then we have the number 7, which is the total amount. And after that, we have the daily value. So this is a very important marker that we need to take into account. And I will tell you why. Mainly the daily value is the amount of the dietary ingredient or the percentage of the daily value that will be covered by that supplement, and that will fully support the recommended dietary intake of that specific vitamin. So for example, with the vitamin C, it's not only giving us the 100% of the dietary intake of that specific date, it's giving us 278%, which means that this could possibly be a good supplement for someone who's dealing with immune recovery, or that might be missing or might be having some deficiencies of this vitamin. And this is something very important because that is something that we can correlate with our nutritional assessment. So that is one of the most important things that we might be looking for in a supplement fact sheet of a behind a supplement. So that is very important. And after that, we can see the number 8. This is an asterisk. So mainly we will have those kind of notes of that or that sign if there comes a situation where we don't know the daily value, and this would mean that we do not have a recommended dietary intake of that specific nutrient. And after that, we need to know what it is inside of that specific supplement, because I was telling before that there are a lot of different forms of vitamins that we can find in the supplement. So we can have vitamin A, but is it a beta carotene, or is it retinol? Is it retinol? So we need to know what is the type of vitamin A that we're taking. So we can see right here that we have 50% as beta carotene. So that is very important for us to know. We need to know exactly what we're taking. And for that, we need to know how to read the supplement facts in the back part of our package.
To that point, one of the things that we have seen is that the FDA, the Federal Drug Administration, they monitor many of the drugs or all of the drugs before they go out to the public. However, the supplements and nutraceuticals, they don't monitor at the level, or they don't even at sometimes. Therefore, we're left with really required documentation in the back of the supplement to be able to assess that. One of the things are the excipients that are used to make the supplements. Now, in terms of when we're looking at this particular thing on number 10, we see the excipients in this situation indicate that it's choline, bitartrate, calcium carbonate. Sometimes it'll give you information as to what type of factory it was produced in and what other things are being produced inside that factory. If you have issues with shellfish, they need to produce the information that it was produced in a factory where they do have shellfish factored in there. However, when we look at these supplements, a lot is based on the trust of the organization, and we're left to really fend for ourselves. So when we assess these things, we have to make sure that we are very clear in terms of what's going on. So I'm going to take the screen here for a second here, and I'm going to see if I can share my side. Thank you. I'll share my side. So can you guys see yourselves here? See? And there we go. And get the sound. And do you guys see the picture for everybody? Yes, you can see it all, right? Or yes or no? Can you see it now?
Yes.
Okay, now you do? Okay, so it's all good right there. So at that point, so when we look at these particular supplements, when we look at this particular area here, we have to see that they have to disclose things like the crustaceans, shellfish, the fish, the eggs, dairy. Some people have allergies towards these supplements, wheats, tree nuts, soybeans, peanuts. These are things that are important because a lot of people may have allergy or allergen resistant issues, and they may cause issues later on in the future as a result of those things. So our goal in this dynamics is to really, really formulate a situation where we can understand what is going on with the patient and what we may cause a problem as a result of it. Now, as we look at these particular areas, as Anna was explaining here, it's very important to review these. All our patients, when they tell us they take supplements, what we do is we actually make sure they bring us these supplements and we take a look at what's going on here. So in many times you'll see astronomical numbers here. We're more of the belief that we're just trying to get the normal products in there. So products that are high quality usually don't have extreme numbers like 10,000 of, let's say, vitamin B6. They have a normal 100%. And so we're looking for more than natural appearance. However, in certain situations, we want to look and see what's going on. You're also going to be able to look at certain supplements. And when you see the products, you're going to see trademarks. And trademarks are these particular components where they have actually certifications. A lot of people don't know that supplements and the way that they're organized are trademarked and lawed and protected by copyright laws. So the way they formulate, the way they allow the vitamin or the supplement to enter the body may be a trademarked or a method where real certification happens, and then we'll mark that, and you'll see certain trademarks and registrations on the bottom to tell you that this is a product that comes from and produced in a way that is trademarked. Now, as I look at this dynamics, one of the things I want to be able to assess is this particular component here. Okay, so when we look at the overall products of what we got here, for Mrs. Faith, when we have a patient who has these questions, these concerns, typically we present these supplements and we go over the supplements with them. When you sit down with a patient and when you sit down with Anna, what are the things that we cover with Anna? If Anna and you can both answer that question in terms of the supplements that we offer our patients.
Right. So, well, they would sit with me and Anna, and then we would get into what supplements they are taking, see where they are undervalued and see where they're perhaps taking too much and how those are tying into the symptoms that they're experiencing, perhaps inflammation. If you were low in vitamin D, you might experience something like hair loss or depression or anxiety or frustration. Then we could evaluate those things in tests that we can perform here or subscribe you to, and then later do outside of the office. And then we would look over those values. And then Anna, I'm sure, can dive a little bit deeper into that as she works on the patients
Anna,
one-on-one.
specifically when we look at a supplement that a person has, let's say, a sensitivity to, okay, and a sensitivity to a supplement, is it important to look at these bottles and really take into consideration the whole presentation of a patient? And what are the things that you look for when you look at working with a certain supplement for an individual?
That's a good question. And I remember, or I recall this specific patient who we had. And this patient, I mean, we were trying to give this patient all, and we were reviewing all of her different supplements. and we were trying to give the best for her. But we after we did the recommendation list and everything, we were so excited about it. And then we find out that this patient had sensitivity towards broccoli. And we had a specific supplement that had broccoli on its ingredients. So we had to take it away to just to get rid of that suspicion and to like not to mess her sensitivities with
Yes,
that
these,
specific.
as you indicated, a lot of these allergies, they're very difficult to find. And our goal, and when you assess something, you have to really look inside the ingredients of a supplement to see exactly what is appropriate. And you may be surprised that even the things and just example as peanuts, it may be the fact that the excipient has peanut oil in it as a product used in the processing of the supplement. And you got to be able to understand that if you have a sensitivity to that, you may be in a situation where you actually cause issues. So it's very important to kind of see these things as we look at. So as we look at these dynamics, overall, I think we give a general view here. But when we go back into this particular thing, it's very important to kind of look at these supplements, okay, and to review this particular product line, okay, or the back of it. And as Anna was fairly eloquent able to do, let me kind of open this up here. We got to look at the overall purpose of how we see these things. Now, sometimes, as Anna was saying, if you take too much of whatever, you may end up having, what did you call it? Expensive what?
Oh man.
Yeah, the expensive urine. That's what she said, right? So it's very. She said that. I didn't say that. Okay.
Sorry.
So the whole idea here is that it's important to be able to determine what's best for you. So have your provider, your doctor, make sure that, as a suggestion, a real strong suggestion. Some people are taking medications, and some, they're very, very powerful medications that can be affected by simple, magnesium or potassium. And some people have, certain blood thinning medications. And if you take, potassium or vitamin K, let's assume that there's one of the very popular supplements that are given here is a vitamin D with K2. And if you do that, well, you may be causing a reaction or a side effect that the cardiologist didn't want you to do. So it's important to work with the providers to make sure what's going on, to see what's actually happening. That's only one example. There's lots of examples of things we have to evaluate. So as we do these things, we want to make sure we are very mindful of what is going on in a patient's particular dynamics. So today was a short one. We wanted to brief that up, and I wanted to at least keep connected with you guys. And we'll be discussing some more topics specifically regarding supplements and probiotics and not only probiotics, but phytonutrients in the next couple of weeks. So look forward to talking to you guys, and thank you guys. Anything else you guys wanted to add at this point? You guys look great in green, guys. You guys look great in green. Okay. So that was great, guys. You did good. So I'll talk to you guys later, and we'll have a blessed day today.